Town of Islip Supervisor Angie Carpenter, and we're here with our virtual edition of Supervisor Spotlight. And really delighted that Dr. Christopher Raio from Catholic Health Services, Good Samaritan Hospital, is willing to give us a little bit of time and come back on and give us an update on where we are now with COVID-19 as we're in the 3-month stretch. I can hardly believe this has been going on for 3 months. Chris, how are you doing?
I'm doing well. Thank you. Thank you for having me.
Well, this has got to have been a trying time for you and your team at Good Sam and across the CHS system and all the systems, quite frankly.
Yeah, I think it's been a big learning experience for us all, but I also think that we're going to take a lot out of it, and we'll definitely be better prepared for either another coronavirus spike or another type of pandemic if one should occur in the future. I think it's opened a lot of eyes in the healthcare system, and I think we've learned some valuable lessons.
Well, hopefully it's like Murphy's Law. You know, if you're not prepared, it's going to happen, but if you are, it won't. So we're going to be prepared and hope that it doesn't happen again.
Absolutely.
But we're not out of it yet, that's for sure. And I'd like, if you would, please tell us, where are we with the current state of things at the hospitals?
So I would say that we're in a period of cautious transition. So, we are starting to transition to our more, quote, normal types of care for our patients that we're used to seeing. But at the same time, we're not keeping our eye off of what's going on with COVID in the community. And again, I think we've learned a lot, and we've designed certain processes and procedures that will allow us to better care for those types of patients as well.
So you still obviously have COVID patients, because every day on the call with the county, we get the update on how many are in the hospital and how many are in ICU, how many are in vents. And it is so wonderful every day to see that number going down. And I've got all of my notes from day one, and, I occasionally will look back and see where we were. And now to be under 100 countywide really is so terribly reassuring. So obviously the ratio of COVID to non-COVID has changed. So where are you at with that at the hospital?
Yeah, so, we have daily calls where we're tracking these things, obviously, and reporting up, to the local and regional government. But we were at a point where we had multiple, entire units within the building that were all COVID cases. And now we've actually transitioned away from that to where, it's just, patients in certain rooms. So, the proportions of patients has definitely shifted to where, the great majority are non-COVID cases. Every patient who comes into the building who needs to stay, whether it be, an observation for 24 hours or gets admitted, does get tested. So, obviously we're still following all proper isolation protocols for anybody who either tests positive, or even if they test negative, if there's any suspicion whatsoever, we'll keep those patients isolated so that we could care for both them and our other patients.
Do you think going forward that this will be a part of normal protocol, that anyone coming in is going to be tested for COVID specifically?
I do. I think that until we are confident that it's gone completely, or until there's a reliable vaccine, I think that we're going to have to, because we still are concerned that there could be the second spike that everybody talks about and everybody reads about. And I think to avoid that, the testing and the tracing is really critically important. I will say that the testing, from day one till now has ramped up tremendously. And the turnaround times for these tests has really, really been reduced to the point where we get the results back pretty quickly, especially for patients who are staying in the building. So it really hasn't delayed care or delayed patients from being moved to their appropriate bed location.
Chris, in your memory as a physician, can you remember any other disease or virus or anything that you had to test for like this?
So, we've had a few really bad flu seasons over the last 20 years. And I think that the one illness that we sort of can relate this to, and where we had to change processes, where we had to have surge capacity, where we had to move patients to other locations to keep them isolated. I think the big difference was we never hit so quickly and with so many really, really sick patients all at once. And that was really the real scare with COVID. The only other disaster that I've personally dealt with was 9/11, and honestly, that was more a big preparation. And I was working in Nassau County, and we didn't really get any patients, unfortunately. But from an illness perspective, I would say the really bad flu seasons. But I think the difference with COVID and what was so scary with COVID was it was almost like overnight we just saw the influx, and the number of ill patients was really scary.
And the number was going up so rapidly, and that too had to be so frightening. And I remember early on the concern about hospital capacity and, having if you think back to where we were, we certainly are in a far better place now, but having that ship Comfort come in, to increase capacity, building the beds that they did at Stony Brook, you guys at Good Sam and at Southside too, both adding capacity with these huge tents and everything. We've never seen that before.
Yeah, those first couple of days where we were seeing the numbers of critically ill and the numbers of people get intubated, there definitely was some conversation as to, how long can we sustain this, putting these people on ventilators. Is there going to be a point in time where we don't have enough supplies? Thankfully, we never got to that point, and our resources actually came through, and we had backups, and we were never in a position where we had to decide who should be vented or who not. The other thing, the government hospitals that they had put up did actually help us. I know there was a lot of talk in the media, saying that there weren't enough patients going to the Comfort and Javits, but we actually unloaded patients to the Javits Center, and that actually did help us to decompress some of our facilities. Now, it wasn't hundreds and hundreds of patients, but remember, anything helps, and that was a big lift for us to get patients out of the building and provide more space here within CHS.
Well, see, sometimes government can do things right, but there was no way to know at that point when those numbers were surging that was even going to be enough capacity. But I think the fact that people really got serious about it, they, stayed home, they didn't go into the stores unless absolutely necessary. They really followed the protocol that was being laid out for the public, businesses closing, et cetera. All of the hardships that we had to go through, I think, paid off. And I think there's no doubt that the community contributed to helping to control this. Obviously, it's a tragedy, all the deaths that did occur, but it could have been so much worse if everybody didn't get together and do what they needed to do. Well, we're going to take a little break here with Supervisor Spotlight, and we're delighted to have with us Chris Raio today, Dr. Chris Raio, who's head of emergency medicine. We'll be back in a few.
You are watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. This is Angie Carpenter, your Town of Islip Supervisor, and we're delighted to have with us again today Dr. Chris Raio, head of emergency medicine at Good Samaritan Hospital, Catholic Health Services, who has been in the forefront of this whole issue with the pandemic from day one and has done an extraordinary job. And he's been able to update us and be a source of information and helped with getting our staff to a point that they needed to be to make sure that we followed all of the protocols. So, Chris, we thank you so much.
No, it's been great to be able to help.
Thank you. We're talking about where we are with everything. The hospitals have been cleared for the most part. We're in phase 2 now for elective surgery. But are there any hospital services that are not up and running yet?
No, I mean, we're really fully operational. We had a staged plan to ramp up those elective surgeries. I believe the latest numbers for this week were we were going to be completing about 80 to 90% of our typical cases in the operating rooms. But I do think it's important that the public knows that the hospitals are a safe place. All the services are going full tilt, and if there are, emerging problems or otherwise, the safest thing to do is reach out to your physician, come to the emergency department if you think you need it, and we have the appropriate staffing, the appropriate protocols to keep you safe and to keep ourselves safe.
So, the worst thing anybody can do with any kind of medical condition, I would think, I'm certainly not a medical professional, but, lived a number of years and raised kids, and we've been through, challenges. But to ignore something and not seek that treatment early can really, really make a very negative difference going forward in treating whatever the issue is. Are you seeing patients now who are worried about coming to the hospital?
Yeah, we're definitely seeing, I think early on there was a national survey that showed that a large majority of people were still fearful about coming to the emergency department, and this was across the country. I think, the message obviously early on was everybody stay at home as much as you can. I think, we're starting to try to shift that message because we don't want people to feel like they can't come to the hospitals, to their physicians, to the emergency departments. But we definitely have seen over the last several months patients waiting, a little bit longer to come in, whether it be with, abdominal pain and then they later have appendicitis or, chest pain or, stroke-like symptoms. Really, I think the message is if you have any concerning symptoms, you should, seek the help of the healthcare community early on because we don't want to see any negative outcomes from delay in care.
You've mentioned two things in particular that, we've had in my family encounters with, with heart issues and also stroke. And in both of those cases, it is so critical to pay attention to the warning signs and to seek that medical intervention quickly. And if you don't mind, I would really like to touch on the stroke component because I know that there is an acronym for what you're supposed to be doing. And if you see someone with the symptoms, get them to the hospital immediately because there's that 3-hour window when they can get a TPA shot that will sort of minimize any long-term effects of stroke.
Yes, I mean, time is really of the essence, and getting to the hospital as quickly as possible is really of the essence. You mentioned the 3-hour time frame. There are certain cases now where we're using the clot-busting medications up to 4.5 hours. Here at Good Sam, we're lucky enough to have a comprehensive stroke center where we also will do neurointerventional procedures, which is great. So that we actually take the patients to the operating room and can actually go in and either remove the clot or potentially scoop it out. Really, the symptoms for stroke, tingling, numbness, weakness, any lightheadedness, dizziness, any facial droops, any of those symptoms, really you should try to get to the hospital as quickly as you possibly can.
That is really, really good advice. And, I know personally of a case where they were able to get to the hospital in that window that was necessary, and there was no permanent damage, and there very easily could have been. You hear about such tragic cases like that happening. So it's important to pay attention to, the messages your body sends out, and, if you're with someone and things don't look quite right or they're not sounding quite right, don't ignore it. Don't ignore it.
Right. The acronym you were referring to also is FAST, which basically stands for facial droop, arm weakness, speech difficulty, and time. And time, again, is the critical thing, just to get to the hospital as quickly as you possibly can.
Well, we're going to remember that and try to hammer that message home in all of our social media, too. I have been thinking about something in particular. Just today, we've looked at everything that's going on now that we normally would be doing this time of the year as a town as far as programs, et cetera, and evaluating everything and making sure that we stay within the confines of the protocol based on the guidelines that we're getting from the state and from CDC. Normally we run, many, many programs over the summer, swimming programs, camping programs, et cetera, and we just got the guidelines about 2 days ago, and they're pretty stringent in what we should or shouldn't be doing, when you have kids in your care and groups of 10, no more than groups of 10, and keeping them separated and everything. So it's been it's a learning experience, and we're taking it very, very seriously because we don't want to do anything to jeopardize the health and safety of any of our residents.
Yeah,
especially our young people.
Yeah, it's obviously it's a difficult situation. I think everyone, myself included, want to get their kids back to as close as normal as possible. But the flip side is I think right now it's a little too early to go into some of these larger group settings where, particularly with children, social distancing is going to be very difficult, if near impossible. I think over the next couple of weeks to have a better clue and better evidence as to what is really safe and what's not safe, and hopefully we'll have some very positive answers that tells us that we can open some of the things up that you're talking about. Mm-hmm. But as of today, I think it's probably a little too early to go jumping to some of those steps.
Well, when you say jumping to some of those steps, I'm thinking in particular of jumping into the pool. And, that's an area that we've, had a lot of angst over. We've invested, literally millions of dollars in our facilities. We redid a pool in Brentwood, and it is absolutely magnificent. We've only gotten about a season and a half out of it so far since the investment, and a brand new spray park scheduled to open this summer. But at this juncture, we just are not convinced that the public safety can be guaranteed. So for now, they're closed. So it breaks my heart to say that, but I think it's the right thing to do at the end of the day.
Yeah, as of June 10th, I would totally agree. It is the right thing to do. I think, there's no evidence that you can catch coronavirus just from being in the pool with another individual. But, the thing with a public pool is that there's a lot of people there typically, and it's really the social distancing that nobody, I think, feels comfortable today anyway, saying that, that you can do that in a safe way.
Yeah.
And
too, even in the water, there, the guidelines are saying to keep social distancing in the water. It's kind of hard to do with little kids. Exactly. They tend to want to, if you've ever seen a little one, they see someone their size, their age, they tend to want to go running over to them. But, we'll see. We're, again, monitoring very carefully, speaking to people like yourselves and other health experts and CDC and New York State. And, we're going to err on the side, if anything, of caution. But we are going to take a little break. Again, we're with Dr. Chris Raio from Good Samaritan Hospital, Catholic Health Services, talking about where we are in this COVID pandemic, and fortunately, we're on the downside. We'll be right back.
You're watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. This is Angie Carpenter, your Town of Islip Supervisor, and on our virtual broadcast today, we have with us Dr. Chris Raio, Head of Emergency Medicine at Good Samaritan Hospital, Catholic Health Services, doing a fine job all the time, but particularly, you've really stood out there during this pandemic, and we can't thank you enough for all you've done and for your input. We've reached out to you a number of times. We're not health experts here in the town. The towns don't have health departments like the county does, so we feel very blessed that we have someone we can go to.
Oh, it's been great helping.
Thank you. So with that, I have a question for you. So we're on the downslide, thank God. Although I will say I was looking at the numbers from yesterday, and Suffolk County had the highest number of new cases than any other county in the state of New York. Again, between Nassau and Suffolk County, I think we have about 25% of all of the cases in the state of New York. And our numbers, even in the town of Islip, I hate to say I have no pride in this statistic, but we had the highest number of cases, of COVID cases in the entire county were in the town of Islip. And those numbers were more than 22 states, the numbers of cases we had just in a couple of our hamlets, not even town-wide. So, we've had to take this very, very seriously. And so going forward, are there any particular patient populations that you're more worried about during this time of crisis or even as we're coming out of it?
Yeah, so, I think what's been talked about has certainly been patients with other comorbidities. So the elderly patient population in particular, diabetics, patients with hypertension, heart disease, any of the chronic lung diseases, I think that all of those things have been well documented and well publicized. The patients in underserved areas, as well. So, in the lower socioeconomic areas, particularly, we have seen more patients from those areas come in, and a lot of them critically ill. And I think that some of that is access to care, which is a problem that we're working on, but obviously we need to do better. And some of that is also the lack of us getting the education out to those areas with regard to the social isolation and, quarantining processes that, we wanted to put in place months back when this all started. The other patient population, I think that we haven't really seen coming back to the hospitals yet, and even in in talks with a lot of the emergency medicine directors, but also urgent care centers, is the pediatric patient population, and not necessarily talking about COVID-related illness. So I know there's been talk about the Kawasaki-like illness, but more just pediatric patients coming for other things. So I think it's important for parents to know, again, if you have a child and they're ill and you think they need medical care, you should go seek that out and not delay it for fear of contracting COVID. Get your child taken care of.
When you talked about the population with the comorbidities, particularly seniors who have heart disease, lung disease, et cetera, what do you think going forward? And I'm asking you this because one of the first things that we did was close our senior centers. And that has been really devastating on a number of levels, but particularly for the seniors, particularly for those that went to the senior center every day. It was a lifeline for them. And now they don't have that. And, we're trying to make the decision as to when, it would be appropriate and safe. The same, as we're angsting over the pools, when do we open those senior centers, or do we have to put that off until the fall?
Yeah, I think, we've seen a lot of individuals affected by this in different ways. I think certainly there will be a little bit of an uptick in patients with depression and, just not socializing as much as usual is really not healthy for anyone, but particularly the extremes of age, I think, particularly the elderly. And I'm hearing even from my own friends with young children that, they're starting to struggle a little bit not being around their friends and not being able to get out and do things. But, similar to the pool scenario, I think for the elderly, it's still a little too early to be getting back to normal. I think we will learn a lot from this. I think, wearing a mask, keeping, better hygiene, keeping contact surfaces clean. I think that's all going to actually really help, not just for COVID, but for other illnesses. So I think that's a positive. But I think we still, we have to be cautiously optimistic about the successes that we've had so far. But, we still need to protect that elderly population.
We are preparing for the day that we can reopen the centers. We've masks set aside and deep cleaning the centers, and hopefully being able to install the kind of air purification system we put in at the airport that they have in the hospital that really removes the pathogens from the air to try to keep it as sterile an environment and not germ-inducing environment. But again, we're going to just have to keep watching for the guidelines and hopefully make the call to do it at a time that is right and appropriate.
Yeah, I mean, as you said before, it's been, now 3 months, and I think, the term we're talking is quarantine fatigue. So I think some people, are just, they're itching to get out of the house and itching to get back to normal. And we all want to do that. But, again, I think we have to follow the guidelines, take it slow, and, if things go as well as they have been going, hopefully we'll be back to the new normal, pretty quick.
Well, I think that's really very good advice. We've been through a rough 3 months, and we don't want to slide back. And if everybody could kind of keep that in mind, some of the good practices that we've had to keep going with it, and wash your hands. So we need to wind up, but I'd like to do it on a light note. This coming Monday, we will be commencing our drive-in movie series that is being sponsored by Good Samaritan Hospital and Catholic Health Services. And you guys are sponsoring our entire drive-in movie series this summer, every Monday night. And it's being moved around the town in different spots around the town, and it's free admission. And we're really excited about it, and the feedback has been incredible. People, this morning someone said to me, I've never been to a drive-in movie. I of course, am a little bit older and grew up with drive-in movies and got to see them being taken away. So it's kind of exciting to see it happen. So I want to thank you and everyone at Good Sam for being so gracious and helping bring this bit of as you've been there for us through the rough times with COVID and being there to fix everybody up. Now we're giving them an opportunity to bring their families together and enjoy each other's company and some good entertainment all summer long.
Yeah, I think it's a great program. I think a lot of people here are excited about it, and hopefully the community will get out there and have some fun. I
think they will. So again, Dr. Chris Raio, I can't thank you enough for all you've done and for being our guest today on Supervisor Spotlight, and just ask that you please stay healthy and be safe.
Thank you. You too. Thanks for having me.
You're very welcome. Take care. Bye.